I will be presenting on an overview of the regional plan of action for the period 2019-2023 for the implementation of the global vector control response, which is well known by now, famous. So first slide is just to take you a quick overview of the major vector-borne diseases in the Eastern Mediterranean region in our countries, which the country presentations have also presented. So I won't stay too long on this. It's associated with significant morbidity, disability, and mortality, as you can see from the photos. The mosquito-borne diseases, the highlighted major vector-borne disease is malaria. And we have the Aedes transmitted diseases, which will be the focus of today, the Aedes vectors. Also in our region, the leishmaniasis, particularly the cutaneous leishmaniasis, that's more than 70% of the burden is from our region. And also other vector-borne diseases, if you see, they are also presented in this slide. Not sure why it's not going. Okay, so the next slide here is just a map showing you the presence and absence of these reported vector-borne diseases in our region. So if you see here, the legend here, the number of overlapping vector-borne diseases. So the darker color means more overlapping vector-borne diseases. So it's categorized from no vector-borne disease to 1 to 2, 3 to 4 vector-borne diseases, 5 to 6, and more than 7, equal to 7 or more than 7. So the darker the color, that means there's more reported vector-borne diseases from this country. This slide I want to show to highlight that our region is a region of humanitarian emergencies, insecurity, population movement into areas at risk to malaria and other vector-borne diseases in these endemic countries. And the region carries the largest burden of displaced populations globally. 64% of the refugees come from our region. So these photos just show you the internally displaced on the left, internally displaced household, makeshift of a house with, if you see there's tires on the roof, and these tires can be the important habitats of Aedes aegypti, so they can lay the eggs in the tires, and when there's rain, they hatch, and immediately you could have an explosive epidemic, particularly if there's also transovarial transmission where the eggs are already infected. Also the people are the ones which spread these dengue vector-borne diseases or Aedes transmitted diseases. So they move into the areas where there's already Aedes aegypti, dengue vectors, and again, there's a spread of the disease through the movement of the people. And then on the right, you see that the camps, these are also camps in Yemen for the internally displaced populations. This slide just quickly, and I'm sure you've already seen this slide before. This is just the effective vector control approaches. So many of the vector-borne diseases are preventable if the vector control is implemented well, and these diseases can be prevented. The main core vector control interventions are the insecticide-treated bed nets, namely the long-lasting insecticidal nets. And we also have the spraying of insecticide, namely the indoor residual spraying indoors on the walls where the insecticides have a long residual efficacy or a short one, depending on the type of the insecticide. We also have environmental management, such as covering the containers or eliminating of the breeding sites, any disposed containers. We have also the spraying of insecticides such as larviciding on stagnant water or drainage of these stagnant larval breeding sites. or potential. We also have the use of clothing, wearing long clothes, putting on insecticide repellents on your skin, which are safe for the skin, and house improvement to prevent entry of the mosquitoes or the other vectors. So in this slide is just presenting the core vector control intervention, which is the long-lasting insecticidal nets. So these are distributed in the malaria endemic countries, but also the countries that use for cutaneous leishmaniasis. So if you see the countries in blue, these are the countries where the long-lasting insecticidal nets are distributed free of charge in mass campaigns, and in some of them there's also continuous distribution to maintain the universal coverage at the health facilities, distributed at the health facilities, and one net is distributed per 2 persons. So this is the primary vector control intervention. And in the World Malaria Report 2020, it was reported that a total of 13.5 million in our region were distributed. The second core vector control intervention, mainly against the implemented against the malaria vectors, is the indoor residual spraying, which is the spraying of insecticides on the walls, indoors, inside the houses or inside living habitats of the human. And so in the World Malaria Report 2020, about approximately 7.9 million number of people were protected by RS. So just a table showing you which countries implement this campaigns, which countries are in response to outbreaks. This slide just presents the talk of my presentation, which is the regional plan of action for the implementation of the global vector control response. So vector control, as I previously mentioned, the report is a key strategy to control the vector-borne diseases. And the global vector control response was developed by WHO, 3 departments, the NTD, the Global Malaria Program, and the TDR, as a response, as a response to the outbreaks of Aedes-borne diseases, such as dengue, chikungunya, and Zika, and also outbreaks of malaria. It's a strategy to strengthen vector control worldwide, through the increased capacity, improved surveillance, better coordination, and integrated action. And it was endorsed in 2017 during the World Health Assembly, and there was also a resolution adopted for this global vector control response. Our region has developed the regional plan of action for the period 2019 to 2023 for the implementation of this global vector control response. And there's a set of priorities. In the next few slides, I'll present them. So, and the third document, WHO document, which has just recently been published, is a report on the progress of the implementation. So it was by mid-2020. This is the 3rd year of the response. And so this report was published to examine what worked and what could be improved or adapted to ensure that the global vector control response meets its intended goals. And these 3 documents will be shared in the folder that Lena has created for the reading materials. This slide just presents the framework for the global vector control response and the framework in the regional plan of action. So the objective in the regional plan of action is to support the countries to strengthening the capacity and capability for the effective, locally adaptive and sustainable vector control interventions for vector-borne disease control, including response to outbreaks, epidemics, and humanitarian crises, and with the aim to reducing the burden and threat of these diseases, vector-borne diseases in our region. So in order to reduce the burden and threat of vector-borne diseases and to achieve the goals, we need to have effective, locally adapted sustainable vector control in the country. And there are 4 pillars of action. Most of these are strengthening the inter and intra-sectorial action and collaboration, engaging and mobilizing communities, enhancing the vector surveillance and monitoring and evaluation of interventions, and scale up of integrate tools and approaches. And we have foundations which are to enhance the vector control capacity and capability and increase basic and applied research and innovation in order to generate the local evidence. And of course, we need enabling factors in order to achieve, to have these pillars of actions functioning and achieving them. And these are most important: the country leadership, the advocacy, resource mobilization and partner coordination, and regulatory policy and normative support. So just a slide to show you how the developmental process of the regional plan of action. So we started in 2017 to 2018 in selected countries. They conducted the vector control needs assessment in order to provide these challenges, and to identify what are the core areas needed to strengthen the vector control, and to present the set priority activities in the regional plan of action. And also we use the SWOT analysis, which is the strengths, weakness, opportunity, and threats by country participants in the regional insecticide resistant monitoring and management workshop in June 2018. There was a consultation during the same period for the development of this regional plan of action. And then there was a second consultation when the first draft of this regional plan of action was developed, and that was in 2018. And the consultation was with the WHO programs, the national focal points, and experts brought together in that during September 2018. And then a final draft was developed, and it was, of course, the draft was also submitted, or presentation was submitted during the Regional Committee 65 in Sudan in October 2018. And then afterwards, it was published in 2019. So what are the challenges in our region? So these have been presented in the country presentations, but I will just quickly go through the most important. So the inadequate infrastructure for vector surveillance and control, including at points of entry. And this is very concerning because of this invasive Anopheles stephensi, which is currently spreading in our region. And also the human resources, there's shortage, including specialized technical staff in the field of medical entomology, vector surveillance and control. And this is the aim of our current online training of trainees, is to build this capacity on vector surveillance and control. Inadequate coordination between the stakeholders, that means there's still weak multi-sectoral collaboration. There's a high turnover in some countries of these qualified entomology staff. There's insufficient allocation of domestic and external resources, and this is very concerning. And because we need resources in order to continue to surveil, to continue monitor the vectors and provide effective vector control on a timely basis. Widespread insecticide resistance, that's also very, particularly while pyrethroids is used. So there's a widespread of insecticide resistance to pyrethroids. And there's also limited options because of this pyrethroid resistance. We need to rotate to other more expensive insecticides. So the regional plan of action has a set of priority activities. Most important is conducting the national vector control needs assessment. Vector control unit needs to be, with a multi-disease mandate, needs to be established. Also, there needs to be a national interministerial task force for multi-sectoral engagement and vector control. And it's important to include the community and to lead these vector control also with the program. Also, we need to strengthen the vector surveillance. This has to be especially at the points of entry, the development of insecticide resistant management plans in the countries. This is very important in order to use effective insecticides for the vector control tools. or interventions. We need to update the regional or the national risk map of vectors, and also to establish a roster of well-trained entomology vector control experts that can guide the training, and also to provide support, technical support to the countries. So also to establish institutional networks to support the training and building capacity, develop and implement an agenda for basic and applied research in order to, for the operational research to guide more effective vector control interventions. And we need also to train the staff and train in safe handling, application and disposal of pesticides. So what is the progress in implementation of this response, this global vector control response? So the most important, as I already mentioned, is the vector control needs assessment. So it is one of the priority activities in the region, in the regional plan of action. And it's been conducted in a number of countries, which are listed here. During 2017 in Iraq, and then during 2018 to 19 in a number of countries in Iraq, Iran, Morocco, Sudan, and Yemen. The national VCNAs are very important because they identify the core areas and the types of support required for use in advocacy, resource mobilization, and action planning. So, and based on these the findings of the VCNAs, the national integrated vector management strategies have been developed in a number of countries which have conducted the VCNAs in line with the global vector control response. So there's also in progress is the implementation of a number of capacity building activities, which is strengthening insecticide resistant management through a regional workshop in 2018 in Tunis. Also training in vector surveillance of Aedes transmitted diseases, in malaria and other vector-borne diseases, particularly in Yemen, where there's frequent outbreaks of these diseases, and in a humanitarian emergency situation. Strengthening vector surveillance at the points of entry, and this was a pilot in vector identification platform, which was housed in the WHO PAGNet. PAGNet is the ports, the airport, the ground crossing network, which was a joint project, 2 units, us and EMRO IHR, and also co-organized by the VVE Rahman team in the headquarters. And there was also capacity building in tropical research, implementation in the methods and ethics in Bahrain, coordinated the research and innovation unit in our office. Also, most important to highlight is the dengue workshops that have been organized by our partners in Singapore, the National Environment Agency, which are also our partners in this course, as Dr. Ali has mentioned. These have been very supportive and very useful for our region. There was also regional training of trainers on IRS to control malaria and leishmaniasis. This slide, just to show you, this slide is where we report the global vector control response activities. It's a SharePoint developed by the Joint Action Group, which is representation of relevant technical units at the headquarters and the regional offices. So what we do is we enter the information, the report. It's a single database containing the reports, and we enter these reports of the vector control activities that are occurring in the region, at the regional level, and at the country level. And this allows analysts to improve planning and future activities. So just to give you an example, so looking at the VCNA on the right, left, there's a VCNA summary report, which I've put a red circle around it. It will take me to the Power BI summary report, and this is integrated Power BI report drawn from the data that is already there to provide interactive summaries of the activities. So I click on that and I'll show you here. So this is just, let me just remove this. Okay. So this is just showing you where we are with the VCNAs. So the global VCNAs conducted since 2017 are 31 countries out of 238. And this line here is the midpoint where 50%, so the target is to complete VCNA 50% by 2020. So if we see here globally, we haven't reached it. And for EMRO also, only 6 countries have conducted VCNA out of the 22, and we should have done by now 11 countries. So this is just an example to show you where we are, and the example is the VCNAs. And there are other activities that we can monitor through this SharePoint and see where we are. So currently now, amid the COVID-19, what are we doing? We are doing virtual online. So we are continuing to build capacity for the countries, for the national vector control staff on vector surveillance and control. And this is the first one we're currently conducting. And then we are also, there's collaboration with the international institutes for support on capacity building, like our WHO Collaborating Center in Singapore and other institutions on entomology and vector control, and for also vector surveillance monitoring to generate evidence for implementing effective vector control. Also countries will be a number of countries that will be conducting VCNAs to achieve the target and the goal for the conducting the VCNA activity, priority activity. I think that's about it. Yes, thank you very much.